Hi, I'm Brittany Montez, and this is the Orlando Health News Review for May 18th. Orlando Health hospitals have been recognized for their excellence in keeping patients safe and providing quality care. The Leapfrog Group, a national independent organization that's committed to healthcare quality and patient safety, has released its spring 2022 safety grades, in which all Orlando Health legacy hospitals received A grades. Orlando Health Dr. P. Phillips Hospital, Orlando Health Orlando Regional Medical Center, Orlando Health South Seminole Hospital, Orlando Health Health Central Hospital, and Orlando Health South Lake Hospital, which with this current grading period has now received its 8th consecutive A grade. Congratulations to team members who made this great achievement possible. And Orlando Health Winnie Hospital for Women and Babies hosted a special birthday party to bring together a group of children who share something miraculous in common. They were each born at the hospital when their mother was only 22 weeks pregnant. The guest of honor was Diana, who was turning 2, one of the smallest, most premature babies in the world to survive. Diana was considered a micro-preemie, weighing just 350 grams or 12 ounces and 9 inches long when she was born at 22 weeks at Orlando Health Winnie Palmer on Mother's Day of 2020. She spent 6 weeks in the hospital's neonatal intensive care unit before she was strong enough to go home. To commemorate Diana turning 2 in 2022, it seemed only fitting to invite several of the hospital's other 22-weekers to celebrate. The story was even picked up by national media.
Diana is basically unrecognizable comparing her to when she was born now. She demonstrated her will to live, and she continues to be charismatic and loving.
To be able to have this gathering with the families is just, it's a true blessing. And I know I'm excited, and I know it's a blessing and all of these things, but I think the team is grateful and honored that the families actually trusted us to provide care, to be part of their journey and to see them thrive with their families how they should. Is just the ultimate satisfaction for the team.
To have her here today at her almost 2nd birthday is amazing. It's a blessing. We enjoy every day with her at home and seeing her progress and walking and playing with other children. It's amazing.
And Orlando Health is proud to recognize the invaluable partnership and contributions of EMS practitioners in our community who provide life-saving care every day. We're thankful for their dedication to serve our communities. We're honored that they have placed their trust in us as we work together caring for those in need when they need it most.
We received a Unit Citation Class 2 award from the Orlando Fire Department for a call that we ran. A patient was struck by a vehicle traveling at high speed while riding his bicycle. Due to our training and working well together as a crew, we were able to rapidly get him to ORMC to receive life-saving medical treatment by the staff there.
I got hit on a bicycle at 50 miles an hour. I broke my neck, my spinal, my ribs, collapsed ribs, lungs, liver. But the first responders had, whatever they did, they got me to the hospital, and then the doctors had worked on me and saved my life. To hear the story, the actual story, what actually happened, and to know exactly what happened to me, and to look as good as I do today, I'm blessed. Yeah, I'm truly blessed. And I'm thankful for the first responders and the doctors.
Getting #1 feedback in general is pretty special, and then to get positive feedback and have the doctors say that it's because of the care we provided, it's kind of what it's all about.
And we talked to Eric Albert, Senior Director of Orlando Health's Emergency Management Team, to tell us about an upcoming emergency preparedness exercise.
Thanks, Brittany, and that's right. On Friday, May 20th of this year at 1 p.m., we'll be conducting an emergency preparedness drill, or exercise as we call it, of all of our outpatient sites and non-hospital outlier building areas, which is a new CMS and Joint Commission requirement. The exercise will be a code brown scenario centered around severe weather. We ask all team members to register their cell phones and any other devices within the Orlando Health Alert System to receive these alerts. Also, please be sure to check that your work location in Team Member Connect or PeopleSoft is updated and accurate, or you might not receive the alerts, especially when it matters most.
Thanks, Eric. Check Swift for more details about the drill and to access frequently asked questions. And Orlando Health is once again applying for the Orlando Sentinel Top Workplaces Award. And as part of the process, 5,000 team members were randomly selected to participate in an online survey. If you received an email from a company called Energage, please click the link to complete the 5-minute survey by May 23rd. Don't forget the AHRQ Safety Survey is also taking place until May 23rd, and all team members are encouraged to share their feedback. Visit Swift for more information. And on May 25th, local Dunkin restaurants and Dunkin Joy and Childhood Foundation will be supporting Orlando Health Arnold Palmer Hospital for Children through their Iced Coffee Day campaign. On this day, $1 from every iced coffee sold in local Dunkin' restaurants will be donated to Orlando Health Arnold Palmer. Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.